Okay, there we go. Let's begin with a word of prayer. Heavenly Father, we give you thanks for this day and we ask for your continued blessing in our discussion. This is our prayer in Jesus' name, amen. All right, so we have a very interesting topic, but before we get into our topic, I'll just like to introduce you to myself. I'm Dr. Natalie Nash, and I am situated in Trinidad, the country of Trinidad and Tobago. And I'm here at our Lifestyle and Wellness Center, which I'm going to just share my screen and show you an overview of the center, what this looks like, so you can get a feel of, the experience. I've been teaching health for over 14 years, and therefore we have recently opened a lifestyle center last July, and it's been servicing a number of individuals, helping them to restore their body, mind, and their soul. Therefore, let's have a look at the center and what this looks like. Here we go.
Attention. Just watch.
Doc, no audio, huh? Not hearing any audio.
All right, so thank you for that. Well, with no audio, at least you had a chance to have a quiet view. I'm sorry.
Yes.
We'll pop that link in our chat as well as on our little groups. But the thing is that with the center, what is it all about? It's basically offering individuals a time and space where they can come apart from the busy scheduled lives and focus on their health, and we help them to understand what good health looks like and have them practice that on a day-by-day basis. So we run our programs for a period of 21 days, and you can fit in some short stays in between that if you have a discussion with us. And then we do a consultation with you. We make recommendations as to what your plan can be when you go home. And one of the areas that we find that's very needed is coping with stress. And therefore, we do, those sessions with individuals and have them formulate plans by which they can have the tools that's needed to cope with their stressful lives when they return home, as well as to incorporate a healthy life. So in our session today, we're going to be talking about stress, be gone. And we don't want to live chronically long-term having stress in our lives day by day. It really cripples the life and sort of prevents us from experiencing joy and accomplishing so many of our dreams. Therefore, this, as I said, is an interactive session, and I will give you some homework assignments towards the end so that we can have further discussion on this. So we go straight into our presentation. I'm just going to be sharing some slides with you because it will help to give, some context and guide along with our discussion. So stress be gone. And when we think about stress, here I have a couple of things, but if there's anyone in the chat line that you want to share with us, you can simply unmute your mic or place within the chat box information about what you think stress is all about. Okay, welcome. I see we have folks from Ghana on the line. We're happy to have you. And I know that you've invited others. If there's anyone, we're located in Trinidad and Tobago. If you're in another jurisdiction, please share where you are located and we'd be happy to acknowledge that. But stress, does anyone quickly want to mention what stress means to them? And I'm giving you 5 quick seconds. 4, 3, 2. All right, silent night.
Hi, Dr. Nash.
Hi.
Okay, so for me, stress is burdensome. It's a burden.
Yes, it's a
Right.
burden. So burdensome. Thanks, Sister Gwen. Yeah, it's loaded. And it wears you down. We have folks in Barbados. Wonderful. So I had someone tell me recently that stress to her was like so weighty that there are certain things that she would get up in the morning and have a plan, knowing this is what I want to do. I need to accomplish certain goals, just simple little goals. And it seems like the hardest thing to get started, hardest thing to do. And simply because the mind is so preoccupied with whatever the stressor might be. And so you are right on the ball, with stress being burdensome. Wonderful. We have folks from Bahamas. Welcome. And okay. All right, so great. So we are looking at stress. Anxiety is a whole topic on itself, as well as depression. And we do have content that we are so excited to share with you on those topics that will come up afterward, because they all tend to be within the same bucket: stress, anxiety, depression, post-traumatic disorders, and obsessive compulsive behavior, and the list goes on. And what you can do, as well as some herbal agents that could and supplements that can be taken to help to change up the chemistry within your brain and help you to respond better. So life is not simple. There's so many uncertainty and confusion around us, and even our experiences that we may have, even if it's years in our history, that is impacting us even today. And identifying those stressors, it would be important. So we look at this statement here, and it says, many of the diseases from which men suffer are the result of mental depression, grief, anxiety, discontent, remorse, guilt, distrust. They all tend to break down the life forces and to invite decay and death. A strong statement, but yet profoundly true. If you are experiencing any mental discomfort, disorder, or disturbance, it can affect your life in a tangible way. And we're going to be looking at some of those this evening. What are some of the physical and psychological effects on your body, all because of some grief, of some anxiety, of some guilt or remorse, or that is impacting you? So our two definitions we want to look at, and the first one is stressor. And a stressor is an external and internal pressure or stimuli on the body. So whether in your environment, like the heat is, so hot and it just sends you, in a frenzy, or there are certain external pressures. You have pollution, you have, a job, a boss, colleagues, a neighbor, a barking dog, that's just stressing you. That's external. But then you also have the stresses that are internal, what goes on in your brain and what's there buzzing around in your mind that you constantly think about. And most times it may be unpleasant. You do have some pleasant stressors as well, and we'd be looking at that. But what is stress? It is actually your response, my response to that stressor. How do I respond to it? And that makes a big difference. Okay, so we're just looking in the chat. Welcome to folks all the way from Georgia, USA. Wonderful. Arkansas. Wonderful, Donna. And Lola from Jamaica. I know Princess, she's going to be coming to our center next month, and she can't wait to be here. And Wendy's from Georgia, so welcome. And so, we're looking at our response. The stress bothers us because of what is happening and how we respond to that. Look at this picture. The rain is falling, and this man is disturbed about it. Imagine if he was just like cursing and talking and complaining all the time because the rain is falling. What do you think is happening inside of him? He is just going to be he's just in a mad state. You try to tell him good morning, he's not even taking you on, or he's just going about his business. And he can be very much, his blood pressure could be up because all he's thinking about is that this rain is falling and he's getting wet. But what about these children? The same rain is falling, but their attitude to it is different. They decided, let's go out and have some muddy puddles, and they're jumping up and down, and they are so happy. There's this song, Rain, Rain, Go Away. We want to go outside to play, but some children love to go out in the rain. When last have you actually gone out in the rain and gotten wet by it? It's fantastic. I never recall doing it as a child because, you may have been restricted by your mom. But, just a couple months ago, I was out walking one evening, and then I heard something. What was it? There was a rain coming in from the distance. And I was like, oh my goodness, I am still away from home. I will not make it in time. Don't even try to run. And it came, that loud noise just got closer and closer, and there was the downfall. What could I do? Fret? I smiled and I laughed and I said, thank you, Lord. This rain felt so good. And you should try it. It is, such a blessing to be out caught in the rain. But it helps if your attitude towards the situation is one where you can have a smile on your face, then that's going to be altogether a different chemistry within your body as compared to if it is that you're fussing and fretting. All right, and we want to welcome Idris from Canada. Great. So human beings, we are not meant to live in chronic stress situations, because you may have these short episodes of danger, of anxious moments. Surprise, you walk in a room and it's your birthday and all your friends and family are there and your heart starts to race. Oh, please, that's a short-lived event. But then there are long ones where constantly, day after day, you're worried about certain things. That's a chronic stress situation, and we were not designed and built to live in that frame. Therefore, extended periods of stress can downregulate your immune system, produce disease. Your thoughts can make you sick. Your thoughts can also be changed to make you well as you change your thinking. And that has a lot to do with you. You have to work on that. Others can help you to shift your thoughts away from your problems, but you must be willing to, want to, and make that daily choice to stop thinking about the stressors and look the other way in a positive, in order to gain that positive outcome. Now, examples of stressors, we mentioned external factors, so pollution, deadlines with exams and so forth coming on. The heat of the weather can really be a stressor for some people. Overload, where you have too much work to do and too little time in which to get it done. Family relationships can also be a stressor. Just simply the demand of picking up children from school and cooking the meals and cleaning the home and grocery shopping and attending to the little gatherings and so forth. All of those may be very positive, yes, but it can be a lot on some. Finances, as well as, family relationships can also be on the dark side, where you have some family feuds going on or separations taking place. Then the finances, where you have financial difficulties, not enough money to meet your daily needs. And that can be a stress for you. Where is the income going to come from? I have bills to meet. And then death in the family, maybe another area where you have, okay, good, where you have to look at, and someone has been cut off from you, a loved one, and that can place a lot of stress on you. People go into grief, and that can be long term. I know some folks where over a year, they've lost some family member and they still have not gotten over that. Some more than a year, sometimes years, and they still haven't gotten over. Illness. And I saw Sister Williams put in here in the chat, elder care. Yes, taking care of the elderly caregivers. Feel that huge responsibility, and they too can lead long-term stressful lives. And our job may actually impact our lives, our joy. And so your job can be one that just by nature, it is stressful. Here we have another contribution, extreme weather conditions. Yes, certainly we had hurricanes and storms, and it's still ongoing, and individuals to prepare for such, as well as the losses incurred after such a weather event has left many quite stressed. So the stressor is the action, and stress is your reaction. So what's happening and how you react is what you can categorize as your stress. There are different types of stress. Some can be positive, or such as eustress or distress, where it's more the negative, frustrating side of things. But certain stressors can come from sports competition, a job promotion, winning a race. You're excited and you're jumping up and down. Your heart is going to race just the same. And you are going to have, it's an extreme pleasurable situation, but that is going to change the chemistry within your body. That's a stress. And then you have strong feelings of satisfaction. A romantic evening, you're satisfied, good, but it kind of have you a little nervous. Praise for a job well done, your child's success in school, and hearing that news can really, hype you up a bit. But you have some stress that can make you wary. A wedding, and sometimes folks work so hard that the day comes and you can literally see, their faces burdened. A family reunion, going on a trip, a vacation, or something, just getting there. Flights these days with all the delays can really be stressful. Well, for me, I choose not to stress about it. I just have fun. Make sure you have little food in your bag or some monies to buy something, a book to read, and you're good to go. And we'll get there soon enough when we get there. So if you make up your mind and you prepare for that, then it doesn't stress you and you're better able to deal with what comes. You also have some stress that can cause you to be depressed and anxious, and such as job loss, legal problems, a divorce, death of a loved one, that can leave you in a state. So stress in the short term is vital. It happens on a day-by-day basis and we can deal with it. And that can, if it persists over time, can be destructive. Then you have chronic stress tend to break down the body and create that environment to breathe disease. If you were driving down the road and you thought when you looked up ahead that there was something in the road, okay, you're getting closer. It's a baby. What are you gonna do? Just slam on that brakes really hard, and or you can just feel the blood just rush up in your head. It gets hot. You'll probably look red, and you're nervous, and your tongue tastes bitter. And then you recognize it's a doll. It's not even real. Oh, you could be really pouting now. All of that for, thank God it's nothing. So that's a short-term stress that really gets you all worked up. But imagine having that perpetuating in you day after day. And some people have some traumatic experiences where they feel that rush of cortisol, that it's like bitter gall all through their body. They could taste it, they could feel it, a sort of electrical power within their veins, in their blood. And it doesn't feel good. It makes them feel quite weird. And they're like shocked, and then that is an event for whatever the situation might be. If they happen to calm down and get some sleep, you would see that the next day they may be all right and talking to you, but the moment they think about that event or encounter with someone, whatever the situation might have been, all of the feelings and all of the chemicals gets released into the bloodstream again. The heart starts to race, the armpit starts to sweat, and they start to shake in their hands and they're nervous, and it happens again. And the next day they think about it, and every time they think about it, it's hurting them. I remember years ago, I had an encounter with someone, and we were like fighting on an issue, something that I really, really wanted to do and got an opposition for. And I didn't like it. I wanted, things to go a certain way, but I was just prevented. And I remember I would talk about it and try to convince the other person, that what I was suggesting works and why it should continue, but I was just getting opposition. I remember feeling so angered by the situation, uptight, really frustrated, that every time I thought about it, I would instantly get what I call a tension headache, just a piercing pain in my head. And I'll calm down and my day would go into another day and another day, but then I'll think about it again and a sharp piercing pain to my head. And I got to the point where I said, stop, this is hurting me. And I cannot allow it to continue to hurt me. And that's what I want you to get to if you're stressed today, and to recognize what is your stressor and what problem is it creating for you in your body, physically, mentally, emotionally, or what the situation might be that you feel compelled, to be in. What is the problem that you're experiencing, and then seek for a solution. But many times the solutions can be there. There are always solutions, but the fact is, and point, are you ready for a solution? There are folks who are holding on to stressors because they want something to talk about day after day. They love to talk and tell the story. It's a bitter, sweet story. But it's hurting them, and they don't recognize it's a cause for their high blood pressure. It's a cause for their mental faculties to be downregulated. Their memory seems to be waning, and all of those things are happening. And therefore, we want to decide, yes, I want the solution, and to go for it. Okay. Keep muted. All right. So here we also want to just share a stress test with you. These are questions that I want you to ask yourself, and maybe you do have a stressor. So let's take a look. Do you suffer from increased irritability or impatience? What about changes in sleep patterns? You're twisting and tossing when the night comes, you cannot settle to sleep. Then you have changes in your appetite. You just don't feel like eating. No appetite, it's gone. An increase in health problems. One thing after another just seems to be happening to you all at once. It's most times the same driver of these disease conditions. You may have difficulty in concentrating on certain tasks. There might be a lack of energy, a lack of interest in things you used to enjoy. I don't enjoy those things anymore. I don't feel happy anymore. I can't laugh. I don't laugh anymore. And it's really sad. And you're recognizing it. So do you have these things happening to you? What about a sense of being, or you feel cut off or isolated, loneliness, and there's no one around you, even though you might be in an environment where there are literal people, but you feel isolated. And you feel probably that everybody's looking at you and talking about you. Anything that's said, you take it personally. Then there might be a feeling of being out of control of your situation, and just out of your hands. You just don't know how to bring it together to address it, and possibly thoughts of suicide. If these things are happening, then very likely that you are experiencing some form of stress. So first, we need to identify what your stressors are. That's very important. So stress can impact your body, as I mentioned earlier, a headache, body aches, insomnia, where you're not sleeping night after night after night. And this impacts a lot of businessmen, where they're not sleeping, they're stressed. And you can give them all the supplements or herbs, nutraceuticals, everything, to help them to go to sleep, give them a massage, do the water therapies to help them to rest. But their mind keeps going, and they're not resting it. They're not laying it down. And so no sleep is coming. I've met folks like that. 24 hours, not a shut eye. And just counting, 36 hours, not a shut eye, immense stress. So then you find fatigue. A lot of folks just want to sleep, fatigue and weary all the time. Yes, cancer is quite associated with stressful situations. Blood clots or poor circulation, where because you're in a stressful situation, if it's short-lived, you could be so tense that your blood just doesn't flow freely in your body, and it could cause clots. Say if you got a cut, you can form that blood clot really quickly so that you are prevented from bleeding out, and that's positive. But if in a long-term chronic stress situation, you develop blood clots and your platelets are more sticking, then you find that that can pose a problem, and it is real. Not only the production of excess cholesterol levels, but we do have blockage within the arteries taking place with chronic stress situations. High blood pressure, and we talk about that a little bit again shortly, and high blood sugar, let's see, acid reflux, hair loss. Once met a lady where she had immense hair loss, just patches of her hair falling out after a stressful situation. Imagine she had to hear the news of her 2 children being kidnapped, and a ransom of money was called for their lives. And that just hit her like a thunderbolt, and her hair just kept falling. And even though they were recovered alive and back home safely, she could not get over that. Her hair just would not grow, and patches, whatever was there, was just falling out in bits. So hair loss, and the stress can also shrink the brain. You have mental disorders, and self-esteem and productivity can be reduced. So the physical effects, we mentioned increased blood pressure because your heart has to pump harder in this exciting, stressful situation. And then it pumps blood through your body, which could be good if you had to run for your life in a fight or flight situation of a moment. You want all the adrenaline is just going to trigger all of that for you. And you will go leaps and bounds like you're sprinting. And that's good because you're running to safety. But then if it is a chronic stress, long-term, you don't want to have your heart racing and driving blood to your through your veins and to your muscles. In fact, if it's short-term, you'll find that you have this increased strength, and you can just lift up things. And women may know it. Sometimes you depend on the opposite sex to do something for you, and then you get stressed. All of a sudden, you can turn over the house, do everything for yourself. But if it's long-term, you find an opposite effect can take place. You have immense fatigue, and it's because of all these chemicals that's residing in your body now creating a negative impact. So your heart rate would increase, muscular strength, release of glucose from the liver. Your blood sugars can go up. I've met individuals where they became hypertensive after losing a spouse. Another one got diabetes and remained like that, just being a diabetic, triggered from a stressful situation. Increased mental activity, where sometimes you could be so stressed short-term, and you could just think everything clearly. You know exactly what you need to do. But then the opposite could be where you have a lot of brain fog. Then you have increased metabolic rate, decreased blood flow to areas not needed for rapid response, such as your kidneys. You may not urinate frequently enough, or your intestines will shut down, and there's no time for thinking about food because we are in a state of stress. Yes, contribution coming in, inflammation in the body, that's huge. Where you have an inflammation can trigger lots of aches and pains in the body, as long as you have the stress that's happening. Yep. So damage caused by the hormone cortisol can be due to chronic and excessive stress. You find that dementia, mental confusion will take place with certain individuals, obsessive compulsive disorder, anorexia, you're not wanting to eat, and depression, anxiety, impaired memory, shrinkage of the brain, huge. Where the study shows that the brain, physical brain, literally reduces in size with chronic stress situations. Lots of these effects. It's not with a short-term stress, but more so with the long-term stress. In the stress, you have high cortisol that can be released into the body. If individuals use like steroid medication, these things can happen to them. But similarly, if they produce cortisol due to stress, the adrenal gland is just pumping out all of these hormones, then peptic ulcers. That is real. So real. I have had individuals where we're working on their stomach to help them to overcome their indigestion or acid reflux. And they'll be doing everything. The sleep, time, exercise, everything they're following and keeping a good planned diet, but the stress. And so in working closely with individuals, we would see when they have stress going on, even early morning, just on a startup for the job, that impacted them so that they were having discomfort with their digestion and thereby having the ills from it. But once we made some changes and got the person to change up the time and deal with the issues first before settling down to eat, all of the ill effects went away and the stomach was perfect. So whereas before the person was eating first and then going to deal with the stress of setting up the job and the work and everything for the staff, we flipped it around and said, go do that first. And then you come and you eat. So when you sit, the mind was more relaxed. And the gentleman was able to overcome his indigestion and acid reflux, huge burning of the stomach for more than 6 months. And then within a space of 4 to 6 weeks, he was overcoming this and on the path to better health and feeling well. So the peptic ulcers is real because people have this thing continuously. And then you have also type situations going on. Real painful. Hypertension, malnutrition because you're not eating, you have no desire to eat or even eat healthy food. Some might resort to snacking, looking for sugar or salty foods and having those decreased libido, not having that desire for sex because rest and relaxation is on the other side of the spectrum as opposed to stress. So you'll find that the libido would be reduced. Then high blood sugar, suppressed immune system, where there is a reduction in the white blood cells and individuals are more prone to getting infections and cancer. There's been shown, and studies have been shown that folks would go through a period of stress and then they find out after some time that they have cancer. Cancer doesn't just happen overnight. It can take place sometimes like 10 years, 5 years in the making. These days, we're seeing some rapid onsets of cancer. However, you find that cancer is one of those things that's hugely related to stress, and that would be stress can trigger different types of cancers in individuals. Now, there are numerous studies that have been showing, just a second, I see someone. Yeah, okay. There are literal studies that have been showing that everyday negative thoughts, negative stress situation will lead to a reduced blood supply to the heart, muscle, and brain. So whereas a short-term stress, you have a gush of blood running through your body into your muscles and so forth, but a long-term one will just cause everything to be depressed, to be lowered. And so your heart doesn't have sufficient blood supply, your muscles, your brain doesn't get sufficient blood supply, and that can impact you in terms of the function for your heart as well as your brain health and your brain function. And it can lead to strokes. So you also have, because of this knowledge, it's important for us, therefore, to teach cardiac patients or individuals how to manage stress, because there's a connection between what goes on in the mind and how that impacts even artery blockage. There's an increased risk of having arterial blockage, buildup of plaque deposits when individuals are stressed, chronically stressed. And then to teach them how to manage their stress will improve their blood pressure, their cholesterol levels, where you have better HDL levels, their weight would be regulated, their eating habits and exercise programs will be regulated. It would be happier, they'd be actually eating and exercising if they and doing all of these things to help to manage their stress, but at the same time, it's going to have a positive benefit to them. And so stress can increase blood pressure and blockage in the carotid artery and heart rhythm. It's been shown that when a scan was done to look at that carotid artery right on the side of the neck, if perchance there was any blockage there, it's very likely that there would be similar blockages, with buildup of plaque deposits and so forth throughout other areas of the body where you have arteries running and flowing, and therefore even the arteries that supports the heart. So there is a connection, and therefore if individuals have strokes, you need to teach them about managing their stress. Most times it's the stress that brings on a stroke, and but in getting back to the root cause, which is the stress, can be the solution, and it's not something to overlook. Then there are other diseases, and this is just showing you the multiple ways in which disease can come upon the body and what is the cause. Always look for the root cause. And then you find that herpes, if individuals have had the herpes virus in the past, they may be okay, but in a moment of stress, it rises up its ugly head, and they're wondering, where did I get this thing from? And then you find that asthma can be developed or even triggered due to stress. Quite interesting that the body produces certain chemicals that can cause you to have breathing issues, put you into an asthma state. Or if you're accustomed to having asthma, just the anxiety and the stress can bring that on. You can have asthma. Then HIV and AIDS, where you may have contracted the HIV virus, and so you have a lower white blood cells, and your immune system is lowered. That can aid in the progression to the state of AIDS. Eczemas, psoriasis, where certain chemicals are released within the bloodstream, and it shows that inflammation on the skin. And again, individuals will see that if they were to calm down, have coping mechanisms, that they would be okay. But the moment they go through stressful situations, they get flare-up of these skin issues. Irritable bowel syndrome. Individuals would experience abdominal pain, bloating, diarrhea, and constipation even, simply because of going through a stressful time in their lives. It manifests itself in such a literal way. Folks may have lost their loved ones. I know of a young child who lost his mom, and he has chronic constipation beyond all the efforts that they're trying to help him with. And so what you need to do now is to help the young child to have coping skills and coping mechanism. Try to divert his mind and get him to think about other things, because it's real as to how it plays out in the body. It also shuts down digestion, and you have reproductive health that would be impacted. Men have reduced sperm count when it is that they are stressed. The chemicals that's released in the body, apart from having a low libido, they have erectile dysfunction as well as reduced sperm count. So they, apparently could come across as being infertile when all they needed to do was just calm down and relax. And that has happened to many couples, thinking they cannot bear children. And so they just decide to go off on a vacation somewhere, relax, and wow, you see it happen. That they're able to conceive. Similarly, you'll find that women who are pregnant, and if they are stressed at the same time at the beginning of pregnancy or even during the pregnancy, they are more likely to have difficulties through the pregnancy state. And that can cause them, sometimes the child may have some kind of deformity or some kind of impact. And if not the child, then the mom can have some difficulties through the pregnancy time. Hip fractures is real. You find that the amount of cortisol that's produced in the body tends to take a toll on the skeletal structure. And so the bones take a hit for it, similarly as if you were taking cortisone medication. And so it can, if you were smoking or have, which a lot of folks, if they're stressed, they go into smoking to help to sort of calm them down, or they have poor eating habits. So all of that sort of impacts your bone density, the absorption of calcium, because you're not absorbing your food well and digesting your food well in the first place. So you may have issues going on. And psychological reactions in the responses, irritability, anxiety, inhibited sexual desire, depression, low self-esteem, absenteeism from work and school. Folks just, especially when they get into the states of anxiety and depression, they feel like they cannot move. And some, I know, would refrain from going to work because I can't face people, or there's going to be too much talk in my head. I just want quiet. Or even young people now are having problems. This situation of stress, anxiety, depression is not just hitting a certain age of adults, but even younger. Teenagers are being impacted. Yeah, I reckon my shots need to correct. Okay, so then psychological responses, difficulty concentrating, making errors in decision making because your mind is so preoccupied with so many other things going on. And so you're unable to accurately analyze the situation and to think through clearly. You find that individuals may be disorganized in their thinking, in their problem solving, and you can't really get much from them because of the stressful state that they are in, and then their productivity is low. So sometimes relying on someone to do their piece in a project may be challenged, and inability to speak fluently, and their thoughts are so disconnected that even verbalizing and communicating can be really sort of chopped up. And then lack of enthusiasm for preferred activities. It's just not there. So stress can impact the brain. We talk about the brain shrinkage, but the brain can become altered by the stress, the trauma, the lack of oxygen to the brain because you're not breathing deep and there are issues going on. And then you have disassociated states where the mind is detached from the body, or emotional states. I've seen where individuals would say, I'm here, but I don't feel like I'm here. I just feel as though my mind is somewhere else and my body is present, but my mind is literally somewhere else. Folks talk about having an out-of-body kind of a feeling. And it is so real because of the stress that they're under. And a lot of times you find it showing up in anxiety and depression states. And then you have substance abuse, where individuals can resort to drugs and alcohol, as well as nicotine, tobacco, cigarettes, vaping, and the list goes on, the marijuana, etc. And that impairs their mental faculties and can create problems. So the question comes to you, am I stressed? Is it possible? I think I am. It shows that I am. And so is it possible to reduce it? Okay, so we have a question. Dr. Pierre, I see your hand up. You can go ahead and unmute.
Okay, no, I was just referring to a question that was presented in the chat. I don't know if you saw it.
Yeah, the last question?
Yes, I think the person was asking about relationship stress with their husband.
All right. Being another
Yeah.
time, it's very stressful for me. I think of divorce, but I'm warned I cannot, because of my religion, any advice or need for help. And there are times when it is so real and we wish for, long for certain things that might not be achievable at the time. One of the things I'd say, don't lose hope. It starts off with simply being prayerful and asking God to guide your mind into what you need to focus on. And sometimes you need to have that accepting things for what they are. And that's what you have before you. That's what you need to live with for the moment. But at the same time, if you stop focusing on the issues and just being grateful for what you have, diverting the mind away from the challenges, that can be a way in which it can help you to cope. In our next sessions, we're going to look at the coping mechanisms. And sometimes it's like not looking at the outside, not keeping our eyes on the problem, but rather what kind of solutions could we implement in order to help us to go through. So the stressor may still be there, and that's one of the big things with some stressors you can get rid of. And then there are some stressors that lives with you. But remember, it's our response to it. Remember the man in the rain versus the children in the rain. So it's our response to it that makes a difference and can help us. Once you recognize too that your stressor, what you're focusing on, is hurting you physically, then there comes a time where you have to tell yourself, for my health, my well-being, for my life, for some of these disease conditions not to take a hold of me, I need to stop. And self-talk can go a long way when you have to stop. I remember years ago when my dad died, that I was pregnant with my daughter. And so I had my moment of grief. So we're talking about stress. It was stressful. It happened. His passing was sudden, not expected. And so I knew that I was grieving. And for 2 months, it was that on my way home from work, I'll just be in tears all the time, just crying. And I will make it happen. I wanted to go through that. I wanted it to happen because it sort of made you feel sort of connected to the loss, and to recognize it, that because sometimes folks could ignore certain things. So I wanted to go through the emotions, and I allowed myself to cry it out, and I'm having conversations in my mind all through it. But then I recognize that time is passing, and when will this end? And I had to do a self-talk, tell myself, stop, because I have a responsibility for an unborn child. I don't want the child to born having some depressed state, and then I have a long-term problem. So I had to talk to myself and say, stop. What's happened has happened. It's out of my control. And I've done my grieving process. It's time to stop. And I prayed and asked God, I need to stop. Talk to myself, you need to stop. And it stopped. And so, to share that with you, that it is possible. Nothing is impossible. There are ways in which we can get through this. And everyone's situation can be different. And I don't know if anyone else has a contribution to this, but that's a couple pointers that I can give. But please return next week, Monday, when we look at different ways and strategies to cope with stress.
Dr. Nash,
Yes.
can I share something, please, in reference to that question?
Yeah, sure.
Okay, so I just like to share. I experienced the question that the person is asking, let me say, about the relationship, the stress in the relationship with the husband that's being a non-Adventist. You have husbands who are Adventists who give you stress. But here's what I learned. I've been through it, and here's what I learned. I learned that God does not want us to go through, any abuse, or I don't know whether abuse is happening, but God doesn't want us to live like that. And if it's better for us and healthier for us to live apart, then it's better. It's not, God does not want us to stay in that type of situation, because we'll never be healthy. We'll always be worried. So I learned that you can leave the marriage or the relationship, whatever it is, you can leave, and you can be happy by yourself. It's better to be happy by yourself than to be in that type of a situation, because God doesn't want us to live like that.
Mm-hmm. All right, so there are many ways of resolving the situation, but one of the things too that I would encourage is to have candid discussions. Sometimes folks are not open enough or even honest enough in their conversation. So you really need to bring things out on the table, be honest in your conversations in order to address the problem. And if it is that it's not being corrected, then Sister Olive is offering an alternative there. Yeah. Okay. Good. So next week, this is your homework. We want you to sort of get a paper and write down what are my stressors. All right, so you can just list 5 of your stressors. I wish you have less, but your 5 top stressors, what are they? What do you see trigger them? And what problems occur because of these issues? So if it is a relationship issue, you're identifying what is your stressor, and then what problem does it create for you? And then the next step would be to look for the solution. So if you write down, fill in that blank, then it can help you to be able to put a plan in place. While we're here talking together, you can actually have a plan in place from some things you would hear, what an experience might be from someone else, and that can help you to go through your life and overcome certain stressors. So this is your homework for next week. In stress coping, it's like a stress tank, and there are times when you can take till you can't take anymore, and then you can have 2 ways. Either you overflow, spill over, or you find some relief way of dealing with it. And then it's not stressing you anymore because your tank would not overflow. So with that, It brings us to the end of our discussion, where we would next go to look at the keys for and coping strategies for stress. Right, so I want to just drop within the chat here. Wow, I'm looking to find everyone. Okay, direct. Meeting. Okay, great. So I'm just gonna that chart. I'm gonna put it within the chat, and therefore you will be able to download it. In addition, when we post up the presentation on YouTube, we'll be able to send a link with that document at the same time. Thank you very much for being a wonderful audience.